very good morning to you. Tell us more about this, what children are suffering when they have it.
Sorry, the line is very unclear. I hope I heard the question right.
Can you hear
So the book that we wrote, all of these things are, sorry, it's very, very weak.
All right, Doctor, yeah, we can hear you. Sorry, I'm going to ask you that again. Tell us more about ADHD and what it actually means if a child is suffering from that.
Okay, so ADHD is a neurodevelopmental condition. So children are born with it. Their brains, there's nothing wrong with it, it just works differently. These children struggle with symptoms such as inattentiveness, hyperactivity, impulsivity, and also emotional dysregulation. And this can contribute that they really battle with academic problems as well as social problems with their friends. And it also leads that some of these kids even have 2 years less of educational attainment. So the important thing with ADHD is that we do identify these children early and that we can give them the assistance that they need. So whether it's classroom intervention, whether it is therapy, and some of them might need medication, which can make a big difference in terms of their ability to concentrate and then also to absorb information and then also obviously to learn.
Why has there been such a dramatic increase in the number of children who are diagnosed of this? I mean, have we been missing something here?
Yes, we have been missing all through the years. So awareness in South Africa has only been increasing over the past 10 years. So people know more about ADHD, they're more aware of the symptoms, and they're more prone to seek assistance or at least a complete diagnostic assessment to make sure whether someone has ADHD or not. If we look through the years, ADHD is not a new diagnosis. The first time it was described was even in the 1800s, and the diagnostic criteria early 1900. But because of the increased awareness, we do identify children earlier. We know that the prevalence rate has been stable also throughout the years, and that is across nations, across socioeconomic strata, and it's roughly 5% of school-age children do have ADHD, and 2 out of 3 children will still have symptoms in adulthood.
How do you get this? What happens? Is it something that you are born with? Is it something that is learned? I mean, what goes wrong?
Okay, so Jane, it is a neurodevelopmental disorder, and in psychiatry, it's the most genetic condition of all conditions. It's similar, the inheritance rate, to your eye color or your height. Now, everyone with ADHD don't necessarily have a gene for ADHD or a family history of ADHD, and we do see many children that have a combination of genetic factors that specifically influence how their brain produces something, for example, like dopamine, which is one of the important neurotransmitters that help us to concentrate and to focus, but also to prevent distractibility in the environment, not to be inattentive.
All right, tell us more about
it. It is definitely not due to bad parenting, and it's and also not due to food stuff that we eat wrong, although certain food can aggravate it.
Tell us a little bit more about what you're hoping to achieve with the book. I mean, how it's going to bring greater understanding, and tell us more about the treatment that's out there, because it seems that the easiest thing to give kids is Ritalin, and many parents are against that. Should they be?
Okay, so the very first important thing in treatment is that when we talk about treatment, it's definitely not only medication. So the very, very first step is to make sure that the diagnosis is correct. And it's not something that we do in 5 minutes in a consultation. It's a comprehensive assessment. Symptoms should be present in different circumstances, at school, at home, at church, between friends. And it also should be there throughout the lifespan. It's not something that just suddenly develops. What is important, if you are very, very sure about the diagnosis, you also need to make sure that you exclude other conditions that can mimic ADHD, eye problems, ear problems, anxiety, depression, a tired child, a hungry child, trauma. And then once you're sure about the diagnosis, there's first what we call conservative management. You make sure that the child's lifestyle is good. They sleep enough, they eat healthy, they exercise. We assist with therapy, so in terms of social skills, in terms of emotional regulation, and also to give them study skills, for example. and also to assist teachers and parents in terms of classroom intervention and what they can do to help a child. For example, reading with him daily. Only then do we consider medication. Medication is a very important role to play, but it's definitely not the only thing we do for a child.
Good to talk to you, Dr. Renata Skuman. Thank you.